Hello all, today we are going to see about the coronary artery disease. The coronary arteries are the one which supply blood, oxygen and nutrients to the heart. The coronary artery disease develops when the major blood vessels that supply the heart may get damaged or diseased. The cholesterol containing deposits or the fatty deposits are called as the plaques. These plaques in the coronary arteries are the major causes for coronary artery disease. A buildup of plaque can narrow the arteries, which decreases the blood flow to the heart. This reduced blood flow causes chest pain, shortness of breath, and other diseases and symptoms. A complete blockage can cause a heart attack. The coronary artery disease refers to narrowing or blockage of the coronary arteries, usually caused by the buildup of fatty materials and cholesterols in the arteries. It is also referred to as coronary heart disease or ischemic heart disease and heart disease. Risk factors or causes. The major causes for the coronary artery disease is that they have a high bad cholesterol and low level of good cholesterols. And the next reason is having high blood pressure, family history of heart disease, having diabetes, they are a smoker, overweight and physically inactive. The symptoms for the coronary arteries is the first one is that chest discomfort. The chest discomfort is described by heaviness, tightness, pressure, aching, burning, numbness, fullness, squeezing and dull ache. The other symptoms are feeling tired, dizziness, lightheadedness, nausea and weakness. The symptoms of men is differed from women. For women, it may be discomfort or pain in the shoulders, neck, abdomen or back. They will feel indigestion and heartburn. They have unexplained anxiety and cold sweat. Risk factors. The major risk factor is the age. Getting older increases the risk of damaged and narrowed arteries. And second one is sex. The men are generally at greater risk for coronary arteries than women. Then third reason is smoking. People who smoke have significantly increased the risk of heart disease. Breathing in second-hand smoke also increases a person's risk for heart disease. Then next one is family history. The family history of heart disease is also associated with higher risk of coronary artery disease, especially if a close relative have developed heart disease. For example, if a father or a brother was diagnosed with a heart disease at the age of 55 or the mother or a sister diagnosed at the age of 65, this will increase the chance for heart disease for that person. Next one is high blood pressure. The uncontrolled high blood pressure can result in hardening and thickening of the arteries, which narrows the blood flow, which may be also a cause for artery disease. Another one is overweight or obesity. Excess weight will make the arteries very thick and it will reduce the blood flow. And another one is physical inactivity. Lack of exercise also associated with the coronary artery disease. And then next one, high stress. The unrelieved stress in family may damage the arteries as well as it increases the chances for coronary artery disease. Then unhealthy diet. Eating too much food that contains high amounts of saturated fats, trans fat, salt and sugar can increase the risk of coronary arteries. Diagnosis. The coronary artery disease can be diagnosed by various tests. First one is ECG. ECG records the electrical activity of the heart. This test can detect heart attack and heart rhythm issues. The next one, exercise stress test. This is a treadmill test to determine how well the heart functions under heart conditions. This test can detect angina and coronary blockages. Then next one is pharmacologic stress disease. Though instead of using exercise to test the heart when it is working its hardest, medication is given to increase the heart rate and mimic the exercise. This can also detect the angina and coronary blockages. Then the last one is echocardiogram. The echocardiogram uses the sound waves to see how well the structures of the heart are working and the overall function of the heart. Another one is blood test. Many blood tests are ordered for factors that affect heart risk such as triglycerides, cholesterol, lipoprotein, HDL and LDL, glucose and other tests. Then cardiac catheterization. This test involves inserting small tubes into the blood vessels of the heart to evaluate the heart function, including the presence of coronary artery disease. The complications for heart disease are heart attack, angina, heart rhythm problems, heart failure, cardiogenic shock and sudden cardiac arrest. The treatments may be, sometimes it may be a surgery or tablets or medicines. Prevention. In order to prevent from heart disease, we have to quit smoking. We have to control the conditions such as high blood pressure, high cholesterol, and diabetes. We have to stay physically active, do some exercises, and maintain a healthy weight, reduce and manage the stress levels, eat low fat, low salt diets that are rich in fruits, vegetables, and whole grains. So, coronary artery disease cannot be cured completely once if it occurs. But if a person has been diagnosed with coronary artery disease, following the healthcare provider's treatment will help to prevent from the condition getting worse. The treatment plan may include procedures and surgeries to increase the blood supply to the heart, lifestyle changes to target the risk factors, and medications. Thank you.